Hello everyone, this is Group 2 and our project is deep brain stimulation with feedback control for Parkinson's disease. I'm Sri Lakshmi Sunil and the other team members are Malika and Alicia. Now let's talk about what's Parkinson's disease first. So Parkinson's disease is actually a progressive central nervous system disorder that affects the movement in the patients. So in Parkinson's disease, certain nerve cells or neurons in the brain gradually break down or die. Many of the symptoms are due to the loss of neurons that produce a chemical messenger called dopamine. And when dopamine levels decrease in the body, it causes abnormal brain activity, leading to the most of the symptoms in Parkinson's disease. Some of the common symptoms in PD include stiffness, tremors, and loss of balance. Although Parkinson's disease can be cured completely, medicines such as levodopa and other treatments like deep brain stimulations are used to improve the symptoms due to PD. Now, one of the common treatments for Parkinson's is medication, which is levodopa. Levodopa is used to increase the dopamine levels in the body and thereby trying to improve the symptoms. Another treatment is deep brain stimulation. The candidates for deep brain stimulation are always patients for whom levodopa doesn't work or for patients who have very extensive Parkinson's symptoms. In deep brain stimulation, a part of the brain is stimulated with the aim of easing the symptoms of due to Parkinson's disease. Now let's talk a little bit about the current DBS treatment for Parkinson's disease. As you can see on the image on the left side, a deep brain stimulation system consists of a lead, an electrode, and a pulse generator. The pulse generator is usually placed on the top part of the chest, either on the left side or on the non-dominant part. Also, for the treatment of PD, the targets where the stimulation is intended is the subthalamic nucleus or the globus pallidus interna. Usually, stimulation of the subthalamic nucleus is done for Parkinson's disease. The stimulation for deep brain stimulation for the Parkinson disease involves a constant current stimulation without a feedback of 130 to 185 hertz frequency. That it's of about 2 to 4 volt amplitude and is of about 60 to 450 microsecond pulse width. In this slide, as you can see on the right, it's actually Medtronic Activa RC deep brain stimulation system. You can see the pulse generator, then there's the leads connected to the pulse generator. And if you look closely, you could see the electrodes as like those tiny dots on the left. And the table on the right describes different programming settings for Medtronic DBS therapy for essential tremor. You can see the different settings for different parameters such as amplitude, pulse width, rate, electrode polarity, and mode.
So how does DBS work? There are different mechanisms that are involved separately or combined to achieve the inhibitory effect of DBS. Jamming, which is altering of the firing pattern to create a meaningless code. Excitation of a sequence of synaptic steps. And suppression of firing, creating a depolarization block, which is due to membrane interactions, loss of electrogenic properties, or synaptic inhibition. The idea of DBS is to induce effects similar to those created by surgical lesions, similar to thalamotomies, which what was used before for Parkinson's before DBS, and the medical treatments that are used now. So the general principle of DBS for Parkinson's is that it's supposed to disrupt the abnormal oscillatory activity that happens in the low beta band, which is supposed to be the root of most of the Parkinsonian motor symptoms. What are the technical features that are incorporated in a DBS system? The most important part is the electrodes. See, the electrodes are can be a 4 or 8 contact stimulating electrodes. They're usually cylindrical, but because of the advance in technology and trying to improve the entire DBS system, we're looking at directional electrodes, which are segmented. And so the number of contacts, the contact length, and the intercontact spacing are important design features that need to be considered for optimum efficiency. So in this diagram, we can see different leads, which is from Medtronic, Abbott, Boston Scientific. So the first two are use cylindrical electrodes, but the ones from Abbott and Boston Scientific incorporate segmented electrodes, which and different contact spacing, which they hope to use to improve current steering to the targeted area, such that whenever if there's any lead displacement, that it doesn't cause any adverse effects because you're able to still steer the current to the right target area. From this diagram, you can see the impact the different type of electrode has on the current spread. So for the first two, they're both cylindrical electrodes, and the bottom three are segmented electrodes. So you can see that the way that by activating different contacts, you're able to control where the current is targeted, especially in figure D, to show the importance and the impact of having a directional electrode. In addition to the technical features that you need to consider, the other two main points are the electrical field and the electrical signal. The electric field has an impact on the current flow and hence the amount of tissue that's activated. So different contacts can be programmed to be the cathode, the anode, or the neutral. So monopolar configurations are when one contact of the electrode sets the cathode and the IPG acts as the anode. Bipolar or multipolar stimulation is when one electrode contact acts as the anode and the other acts as the cathode. The electrical signal comprises of the stimulation rate, the pulse width, and the stimulation amplitude. So the variety of different stimulation configurations can be achieved by altering these parameters and hence trying to individualize current shaping. So most of these systems have either a single current source for each contact or a single source that's shared by all the contacts. Despite DBS being a very effective system for Parkinson's, there are still a number of problems that arise, such as the surgery-related problems itself, so stroke, hemorrhaging, lead migration, lead fracture, therapy-related problems, prickling sensation, headaches, loss of feeling, numbness, gait, loss, mental health issues such as depression, anxiety, or hypomania, and muscle cramps, contractions, cognitive decline, which is often due to current spread to wrong areas of the brain, which can be combated hopefully with the new advances of technology and improving the electrode design.
In the previous slides, we mentioned a few negative effects of the long-term stimulation. Keeping this in mind, we came across a few papers trying to work on a feedback control DBS stimulation. What these papers essentially tried to do was capture the tremor signal and then design the system to detect a tremor. Whenever a tremor was detected, a stimulus was sent. We tried to simulate their approach and divided it into three parts. The first one was capturing the data. To do so, we used a smartphone accelerometer and a gyroscope. The accelerometer captured the motion of the movement, whereas the gyroscope captured the orientation of the signal. Our second step was, once we've captured the data, how do we analyze where the signal is and what the tremor signal is? To do so, we make use of the power spectral density. And what the power spectral density does is gives us an idea as to what is the dominant frequency and what is the power at that particular frequency. The third step was to stimulate it whenever we detected a tremor, and a tremor was detected based on the peak frequency and the peak amplitude. In the coming slides, we show you the output of the previously described steps. On the left, you can see two graphs, that is one for the accelerometer and one for the gyroscope. Our original signal has three components, that is the X, Y, and Z components. Each of these components are passed through a bandpass filter to get a filtered output. As you can see in these graphs, the, the signal in red is the original signal and the filtered signal is depicted by blue. Once we have a filtered signal, we then move on to the next step, which is finding the power spectral density. We find the power spectral density for each of the components. In doing so, we're trying to find which axis is the dominant one. That is, in which axis does majority of our motion and movement lie in. Once we've done so, we try to find which is the dominant frequency. Our dominant frequency is described as a peak frequency, which helps us identify whether this is a tremor signal or it's not a tremor signal. In our case, we find out that our dominant frequency lies in the range in between 5 to 10, which is in correspondence with the tremor frequency, which is of the range 3.5 to 12 Hz. After we found that our dominant frequency does lie in the tremor range, we then move on to find what we call is the peak tremor amplitude, which is defined as the peak power and the dominant frequency. So far, we've identified that a tremor appears, but not when it has appeared. To identify the time instance, we divide our signal into intervals of 3 seconds. For each 3-second signal, we then find the peak power and the frequency as per the steps previously described. If the peak power of the 3-second interval is about 80% of the tremor amplitude, it is considered to be a tremor signal. And if the dominant frequency lies in the range of 3.5 to 7.5 Hz, we indicate it with a tremor pulse, as we can see, as shown in the figure 2. The figure 2 shows us that 2 tremor pulses have been detected, one in the range of 15 to 25 seconds and the other one from 55 to 65 seconds. Now that we've identified where our tremor has occurred, that is when our tremor has occurred, we can now send a stimulus. We selected a stimulus of 3 milliamperes, and the stimulus is given the moment we detect a tremor. In this case, we've shown you one instance of the stimulation pulse, which is at about 18 seconds, which is in correspondence to the second graph.
These are our references. Thank you.